I get to also introduce Amrita. Amrita Tripathi, who's going to host the next panel, runs the Health Collective. So she's honestly the reason we are all here. So for the last 6 years, she's helped create dialogues and conversations around the topic and some of the most difficult topics, if I may say. Amrita is a writer, former news anchor with more than 16 years of experience in journalism, spanning print, digital, and broadcast. She's the author of Broken News, Sibius Not, and the Mindscape series that you see here. There are some books outside. Please buy them, give them to your friend. Amrita, over to you. Thank you.
So Ishita Mehra, who joins us today, whose art postcards you will find in the back. Please pick up a few sets if you would like to. She is working right now for an outdoor education program supporting environmental conservation in eastern Nepal. She's a trained mental health advocate. She's a peer supporter. Her experience with mental illness, recognizing the systemic injustices to maintain the healthcare gap and mental health adversities due to environmental damage inspire her to write. She also illustrates and shares these experiences about environmental injustice. So that's several topics in one. Thank you for joining us and for being such a fantastic contributor to the Health Collective. In fact, your work has been featured in our book, in Young Mental Health and on the site, so thank you for that. Ayushi, you've heard already a little bit about the co-founder of Mental Health Talks India. And I just want to talk a little bit about the essay I passed around because you've gotten that formal introduction from Anindita. Ayushi wrote this fantastic piece on what it's like to live with anxiety. And no, it is not just nervousness. And that piece was featured on our site in our book, Age of Anxiety, and was actually awarded by the SCARF Awards as a special mention. And it would have been more than a special mention if we'd been an official news site, we discovered. Thank you for taking the time for this. So let me just start by asking you a little bit. We have, just to ensure we do no harm, we have Meghna Mukherjee in the back, who is a therapist. So in case any questions come up or anyone feels triggered, we're going to direct them to her. So one thing I promised my mom like 6 years ago was to let everyone know I'm not a therapist. I'm here to facilitate conversations. But if anything comes up, we have trained people in the room that we'd like to, direct your questions to. But let me start by asking Ayushi, when you talk about anxiety in this piece, we're kind of circulating whoever wants to see it. It's not nervousness. It's not an Instagram aesthetic. It's not a quirk. All of these things are things you felt because of the interactions you were having with people who kind of either take it very seriously or think it's kind of a fad that we'll do a reel about and then it'll be done. Is that accurate to say?
Yeah, pretty much, because then there are like two poles of it. Like you either treat it as a very frivolous thing that, okay, like everyone has anxiety. And I mean, I don't want to disregard somebody else's experience because I don't know what they're feeling. But it's also just commonsensical to understand that not everyone has anxiety. It's not gonna be just like that. As much as I hate going by like, okay, you need to be diagnosed that, okay, now you have anxiety and now only you're going to be taken seriously. But at the same time, there are going to be, like, it is a spectrum. There is a change in intensity. There is a change in how you experience those symptoms, how you experience those emotions, how you experience those feelings, and how it has been really debilitating for me. It hasn't just been that, okay, I can like get over it really quickly as I can get over with like some random nervousness. But like when it is anxiety, I can't get over it with like really quickly.
Yeah.
And otherwise, the other spectrum, the other end of the spectrum, or like somewhere on the spectrum it is, wherein it becomes like this quirky little thing wherein you talk about it and it's like all fun and games. Brands want to talk about it in weird terms that, okay, yeah, now you have like a personality trait, like, oh, you are like this manic pixie dream girl, kind of a weird stereotype. And it doesn't work like that as well, because you can't romanticize it, but you also can't trivialize it.
Yeah. I think that's so fair. And a lot of us have been hearing a lot about the spectrum, right? Like, so I know we love to talk about the mental health spectrum. Mental health is a spectrum. I think what I've learned over the last 6 years and beyond is all of us have mental health, right? All of us sitting in this room There are days we have good mental health. There are days we have lousy mental health. It doesn't matter if you have a diagnosis or not. There are days that I will be anxious. I mean, before this event, I was like, what the actual fuck was I thinking? I mean, this is insane, right? So I was anxious. Doesn't mean I have an anxiety disorder. Partly what we're seeing is these incredible conversations, Ishita. I think when we started 6 years ago, we didn't find these avenues to even have conversations like this from an India lens or an, India perspective, whatever that means. Most of our case studies were, either from the US or the UK when we were reporting on mental health. What's starting to happen now, though, as we're seeing more of these conversations is part of what Ayushi is describing, right? They're going off into like, okay, here are 5 ways you can cure your mental health, or try this, my 3 tips. How do you address some of this when you're doing your sort of peer educating and also as a young mental health advocate?
It's very tricky. I don't know if I'm audible. It's very tricky because a lot of times I recognize that the diversity in India is beyond one's capacity to sometimes understand, and it has to come with understanding your own identity in the huge spectrum that you come from. Like, for instance, as an upper caste, very fair skinned, Hindi speaking North Indian in this country, I cannot just firstly, as a mental health advocate, I'm not supposed to advise or suggest things. That's one thing I hope that people understand, because in advocacy, you're helping people be aware of their mental health, or there are types of advocacy, but you don't have to advise or suggest someone. But if someone does come to me with an idea that, hey, these are the things that maybe I can try, it's to see that if it's culturally appropriate for them and it works for them and for that individual, not even a whole group of cultural, or ethnic group or caste group, because it just doesn't work that way. And for instance, I remember, there was this one, I think, tip that I got that, hey, have a warm shower. And I'm like, firstly, India mein pani nahi aata hai. And then you're like, half of the times you don't have showers, you have bath. So like those kind of things don't culturally work.
Yeah, have a warm balti bath.
Yeah,
है ना? वो ऐसे बोल रहे हैं.
So I think that's one of the ideas.
So you have to be cognizant that it's also individuals you're talking to.
Exactly.
I do want to share that, we're going to do about 15 minutes more of this chat and open up for questions. We'll have about 10 minutes for question and answer. And Abhishek, who's been helping us in the back. Thank you, Abhishek, who's a partner of the collective. Thank you. We'll now unveil this beautiful poster that Ishita made for us, which has also gone out on our social for whoever missed it. We'll give it about 30 to 45 seconds, but I will stay with Ishita to ask you a little bit about what this illustration and writing was. Why do you share your stories, knowing that so many things are stacked up against us, right? We heard in the first panel, you still get the same kind of questions from people. There is still stigma. I know that we can't tackle it all in this one room together. Why do you feel like you want to share your stories? And this is up.
Thank you.
Firstly, I love this. Thank you.
Thank you for sharing. I don't think so. It came from a need or a standpoint of a need to do it. It was more natural as an artist, where I started illustrating things and just sharing it. And I probably didn't understand the gravity of sharing an art piece, because I didn't know how much art can speak to people, and it builds communities together, and it actually really binds people together without words oftentimes, and it brings out emotions that they probably didn't realize they have, which is amazing, because that's all of you here will have one song that really speaks to you. And it could not necessarily be in words. It could be an instrumental. And you still have that emotion evoked in you about, I don't know, could be a mental illness, health challenge, life challenge, or anything like that. So it came more from that point of view. But often when I do share this, it's easier to recognize that people resonate with art and resonate with the drawing, or maybe the form or the colors of it, and suddenly they're able to spark up or start a conversation about mental health. That, I really felt that this work was amazing. It gave me a lot of calm, or it resonated with me at a time when I was very low. So it started with somewhat like that, and I continue doing it, recognizing that it's helpful not just for me, but for other people as well.
Yeah. No, and you've done some fantastic work with Sangat as well. I mean, shout out to Patty, wherever she is, because she introduced us and introduced me to your work. Ayushi, do you find that this kind of feeds into what you were saying earlier about finding the language, like let's say, and no parents were harmed in the making of these panels. Let me just say whatever you've heard till now, but finding that language, finding connections that are not necessarily the mental health vocabulary and jargon some of us are learning. Do you think that you would take any entry point into this conversation that you would get at this point, just to make it easier?
I am not sure what you're asking.
So whether it's art or pop culture or references, are you looking for ways to make it simpler for people just to have these?
Yeah, definitely. So like I am a major Bollywood like person. Like I just love Bollywood. Like I'm very filmy like that. And I have like I literally come with an agenda anywhere and everywhere in this mental health advocacy framework that I want to talk about mental health in. I think I'm just like speaking like a broken record. But yeah, so I want to talk about mental health in a way that all of my friends get it. And I think it's the trauma or whatever, like it has given me a sense of humor as well. So I want to utilize that and using pop culture references and just creating a dialogue around it, like using that just as an entry point so that it's not even like simplified, overtly simplified, but it creates like, it's almost gimmicky in a way that like you just attract the audience because they like see some Shah Rukh Khan meme over there and then you'll read a whole thing because it attracted you with the Shah Rukh Khan meme. And then you tell them what you want to tell them in a language that speaks to them. So I think pop culture references definitely help a lot for sure.
Yeah, that was a super loaded question because I've seen her Instagram. Thank you for validating. But coming back to a little bit of what you were talking about in the earlier panel, Ishita, I want to put this to both of you. You are young mental health advocates. You've chosen, you also want to be, a peer supporter. You want to talk about these things. Do you feel sometimes that you're shouldering too much of this and you just want to have a regular conversation and let someone else pick up the slack? Or do you feel there's a lot still to be done in terms of, let's say, busting myths, which we'll come to after that? Ishita and then Ayushi.
I do. I think when I first started or was getting trained in mental health advocacy, I didn't know what it was. And I think it just happened more as a situational thing. Over the years, I did realize that there's a lot more that you get aware about, and with respect to like you mentioned in the bio as well, like the environmental damage, the discrimination based on caste and class, and especially if you're coming from, maybe if you're coming from a background where you're so privileged that your bubble was never popped, it would be very hard to be like in that space where your bubble is popped and you recognize that there's a lot going on beyond just your stupid silly issues ke aaj chai mein doodh phat gaya or something like that. And I think it's not shouldering so much, but I do recognize that a lot of people do approach me thinking that I'm going to be in a space to give advice or suggestion. But I'm not, because my part is just to make them aware and also to provide them with some sort of references that they can reach out to, either be it clinical or expert references. So I do feel like there could be a sense of misconception of what advocacy means often. Maybe it could be language barrier. Maybe it's also part of some lack of awareness in India still about what all mental health advocates can do and cannot do. And I would not want to, what is that called? Like, I'm suddenly in loss of words.
Mislead or
Not
misrepresent?
just mislead, but actually cross my boundaries of what I can do and not do.
Yeah.
So, but I'm very happy that I'm in this position to be able to do it. And the next thing or the next step I feel is that I often try to give up my seat and support more of the advocates who are coming from more marginalized backgrounds, because they do need a lot of support. Either it's in the form of donating money to those groups, or even a retweet, or sharing it on Instagram or anything like that can help, or being a part of their collective but not dominating it in any way. So that has
Yeah.
been very helpful for me.
Yeah. Ayushi, any thoughts there?
Yeah, I mean, it hasn't, like, I have not felt like that I'm shouldering a lot of stuff because I genuinely don't think I'm doing that much work anyway. And I mean, it's just that I know that I want to do a lot more stuff, so it doesn't necessarily feel that way. I think the shouldering bit definitely feels very annoying when it comes to my personal experiences, because like when you are living with depression and anxiety, and when you are going through something, and even after like all, like you can do all the years of advocacy and write on it and do everything, but like there are definitely times when I try to talk to my friends or when I try to talk to my family members, and they just don't get it, and it becomes doubly exhausting because a, you're exhausted because of your own mental health condition, and b, you're furthermore exhausted because you want to seek support, and then you have to explain people that look, this is how I need to seek support, or this is the kind of support that I need right now. So it becomes like that double-edged sword that you have to do a lot of work all the time, so that is pretty exhausting.
Okay, I'm going to ask one more question and then we'll open up for audience questions. So everyone gather your thoughts. You've already spoken a little bit about myths. Let me ask Ayushi first and then Ishita. Anyone in this audience, anyone who might watch this later or read something you've written or shared on Instagram, how do we be better allies? How do you want to see the support spreading? How do we end this stigma? Because, you know, we've said this in the past as well. It's actually relatively easy, albeit a few panic attacks down, but organizing something like this where you're sitting here and chatting with people in a friendly space, it's harder to have these conversations at home with our families, with our friends. How would you like people to show up as allies?
I think in addition to the personal ways in which people can show up, like one of the personal ways would be like there's a lot of talk about like, okay, like I'm there for you, I'm there for you. Don't keep on like just talking about I'm there for you. Like just like show up, because there's a huge difference in between reassuring a person and doing the same thing, because that takes the whole effort. Because otherwise it's like, okay, I'm just like, you're almost, it almost feels like a person is like saying the right thing, because now there's that conversation that okay, abhi ye bolna hai, sabko pata hai ki bolna kya hai, par karna nahi hai. So I think that bridge needs to be like that gap needs to be bridged. And in addition to that, I think what we really need to also talk about, and it's high time now, that mental health, as much as it is an individual issue, it is a systemic issue as well. There are going to be all the systems of structures of like how the society is built in, how the government is functioning, how the laws are, how every different communities are facing different things in the country, and that does affect people. And we need to talk about those experiences and those setups in our mental health conversations, and not shy away from those that okay, ye bahut political ho gaya, ab nahi baat karne, because that is not how it's going to be like, because we can't choose to talk about something and not the other thing, because it just makes us very uncomfortable, or that we are not ready to accept it yet.
And it is enmeshed in everything.
Yeah.
I think that one is a little hard for me to express in words, because it varies depending on the individuals that we are also being in allyship with. Because it's almost like a game of chess where you know what identity you're coming from and then whom you're supporting. It is tricky sometimes because you don't want to dominate anyone, especially if you're coming from a dominating identity. So let's start with also the idea that are we an ally to ourselves as well? Because often, I know there's a lot of talk about self-love, but it's not easy. And self-love also comes with community love. It's not individual only. I'm not trying to say it in an, I know what that sounds like in the Indian context. I'm not trying to say that, oh, community is everything. Individualism is also a thing. But what I mean to say is like, I'm taking this learning from our indigenous elders who have said that we grow when we grow together as well. It's not just a very isolated growth. So if we are allies to ourselves and kind to ourselves, I'm sure that we'll be able to be kind to others. But at the same time, knowing that if you're in a dominating position, how do you support someone else without like taking their voice or their space completely? And I think one has to be really conscious of that. I think that's the best I can say.
Yeah, no, that's fantastic. And speaking of passing the mic, anyone have questions they would like to ask our panelists? Yeah.
In case if someone comes